It's 3 a.m. Your baby's been on and off the breast for going on 3 hours. You're sore, you're tired, and you're wondering if you even have any milk left. Today, we're going to cut through the noise. Welcome back to the Milk Production Podcast. It's been a little while, and you might be wondering why. Over the past year, in between the child chasing and soccer games and chaos, I've completed my master's in nutrition, and that focused time for education and personal growth helped me lay the foundation for something bigger. Not just this podcast, but a whole ecosystem built around supporting families in the perinatal period. When you visit themilkproduction.com, you'll notice things look a little different. Coming soon, we have the Academy with our very first course on prenatal breastfeeding education, designed to give parents clarity and confidence even before their baby arrives. Also coming soon is the AI tool, which is a 24/7 companion resource that brings lactation education and support right to your fingertips. I'll be bringing you along as these pieces come together, starting with the Academy launch later this year. But more importantly, this podcast is where we'll dive into the real conversations that matter most to families. Everything from early breastfeeding struggles to returning to work to staying nourished and resilient along the way. Think of it as your weekly dose of insight, encouragement, and connection, with a peek behind the scenes of a bigger movement that I really can't wait for you to be a part of. So, with that groundwork laid, let's turn to something that underpins so many breastfeeding challenges and questions: milk supply. What low supply really means, and what to do about it. As a reminder, all of the content that the Milk Production delivers is in alignment with the Academy of Breastfeeding Medicine, the American Academy of Pediatrics, Baby Friendly, World Health Organization, and the United States Centers for Disease Control and Prevention practices. By the end of this episode, you will learn a 90-second at-home intake snapshot you can run now, 3 red flags that mean escalate, and how to protect your supply if you supplement, and how hand expression and hands-on pumping can boost output in the early days. Before we get started with some of those details, let's frame the conversation by defining some terms that come up in the low milk supply conversation. So first, you may have heard of perceived insufficient milk supply. And I've touched on this briefly in other podcast episodes before. Sometimes it's also referred to as self-reported insufficient milk supply. And the acronyms are PIMS and SRIM. Those terms are focused on how the mother is perceiving her supply, the quantity of it, and whether it's enough for baby, versus what the medical community delineates as true low supply. And typically that's related to delayed onset of lactogenesis and or we have transitioned into mature milk supply, but for some reason that volume is not sufficient for baby's nutritional needs. Thinking about that perception, the data that you're gathering might be based off of the fact that baby's cluster feeding, or you're seeing some evening fussiness, or your breasts are soft, they never got to that really full engorged state, or maybe you have low pump output. Now, none of those things individually means that there is in fact low milk supply or low production happening, though they can be indicators that it is. Those things aren't quantifiable without looking at the overall picture and what's going on in other aspects. So we delineate true low supply by the baby's weight trajectory. So think normal weight loss versus abnormal weight loss in the newborn days, slow weight gain, that kind of thing. So weight trajectory, then diapers. So number of wet diapers and stools. We'll review sort of the normal amounts that we want to see depending on baby's age, and then transfer signs. Does it sound like baby's active and swallowing and managing a letdown, and does it look like it's going well? Is there active movement, etc.? And again, we'll review those signs. When we talk about true low supply, remember that we're looking at baby's weight trajectory, the output, and the indications that baby's breastfeeding well. I want to take a moment here to really pause and leave space for the fact that both true low supply and perceived insufficient milk production, or self-reported insufficient milk production, deserve support. But the steps that we do to either ascertain whether there is in fact a low supply, or to support mom and baby through a true low supply, the next steps that we pursue are based off of whether in fact this is perceived or true low supply. And so that's why we talk about those differences in terminology. In this same vein, I want to pause and talk about something that I get asked a lot during the consultations that I do. Moms might say, my baby feeds constantly at night. Do I have low supply? Or I'm concerned I have low supply. And I always try to remind families that evening cluster feeds are actually very common. And sometimes they occur at the same time each day. So maybe it's 5 to 8 p.m. or 10 p.m. to 1 a.m. What we like to do is check the diapers and the overall weight trend, and that can give us sort of insight into the overall picture of feeding. And if those things are solid, then it's likely normal and not low supply. But we would want a little bit more data to pin that down. It's important to delineate. Perception is about what you're seeing, fussiness, frequent feeds, whereas true low supply is about objective signs. Number of wet and dirty diapers, how baby's weight is doing based on what we would expect, and how baby's transferring. Here's a quick snapshot you can run right now. Not a clinical test, just a fast way to notice what's going well and what might need a check-in. First, wet diapers. On day 1 to 3, we want to see the same number of wet diapers that the baby is in terms of day of life. So day 1, 1 wet diaper. Day 2, 2 wet diapers. Day 3, 3 wet diapers. Day 4 and beyond, we want to see greater than or equal to 6 pale, clear, wet diapers. In terms of stools, by day 4 or 5, the stool should be transitioning from that meconium, dark, harder to wipe off stool to that mustard yellow, often looser and seedy stool. And we would expect to see greater than or equal to 3 of those per 24 hours. However, stools vary widely, so if you are at all concerned, definitely talk to your pediatrician. Swallowing. So during a feed, we want to see and hear a rhythmic suck, swallow, breathe pattern. We also see visible jaw movement where the jaw is really opening wide for the big sort of pull of milk in. And that also creates movement in baby's temple. So if you see big active jaw motions with movement, muscular indications here in the temple and in front of the ear, then that's a good indication that baby's nursing well. Also, a lot of times you can hear babies' swallows and they sound like a really soft k sound when they swallow. Sometimes you can't hear a baby swallow. Some are a little bit trickier than others, but often it just sounds like a really soft k sound each time babies swallow. We should also see breast changes after a feed. So the breast should feel softer and lighter and not as engorged as it was at the start of the feed. And babies should be showing relaxation cues, which tells us that okay, the breast was empty, the baby was transferring, and the baby is now becoming satisfied. Ultimately, we also look at weight trend, and we want to think about the latest check. So if at any point there's a greater than 10% loss, I would suggest a same-day evaluation with your pediatrician, lactation consultant, and other care provider. Beyond day 5 or greater than 120 hours of life, just 8 to 10% weight loss that persists into that period, or 75th percentile on the Newt scale, means that we should be carefully assessing whether we need to be supplementing and taking additional measures to protect and encourage supply. The Newt scale is what tells us what is kind of normal weight loss for newborns versus abnormal, atypical, or beyond the norm. And we'll get into the details about how to protect supply separately. So run that snapshot. Check the number of wet and dirty diapers in the past 24 hours. How is the baby swallowing when they're breastfeeding? Can you hear it? Can you see great jaw movement and muscle movement in the temple and in front of the ear? Is the breast softer after the feed than it was when you started? And how's the weight trend going? Is baby beginning to gain weight, or have we plateaued and we haven't exceeded 10%? If most of those things look good, you're likely transferring well. And you can grab that free 90-second intake snapshot in the show notes or at themilkproduction.com. So really important, what we're going to hit on next, we're going to talk about red flags and when to escalate your concerns to a care provider. And I want to remind you that these recommendations are aligned with the Academy of Breastfeeding Medicine and the American Academy of Pediatrics. Anytime weight is greater than 10%, or if weight loss percentile is 8 to 10% at day 5 or beyond, or the baby has lost more weight than 75% of other babies, and you can use the Newt scale to ascertain that data. When that occurs, the action that I recommend is same-day contact with a clinician and or an international board certified lactation consultant. If you are supplementing, protect your supply. It's a good golden rule to remember that when baby is taking a bottle, you should also be removing milk, either by pumping or hand expressing, to make sure that you are stimulating your breast, encouraging your milk supply, and removing milk that is in your breast. What are the red flags I shouldn't ignore? Fewer than 6 wets after day 4, stools not turning yellow by day 4 to 5, lethargy or jaundice, or concerning weight loss. Call the same day. Now, talking about protecting and boosting your output, the question often comes up, is there any medication that I can take? I get this question at least once a day. I also get asked a lot about herbal options. And whether we're talking about prescriptions or herbals, my recommendation is the same. We want to make sure that at first we are following the baseline guidance. Moms should be removing milk by effective and efficient breastfeeds or pumping or hand expression every 3 hours, at least 8 times in a 24-hour period. If you're breastfeeding and you're having these concerns, you may need to refresh the latch or position or visit with a lactation consultant who can help you tweak or modify those. If you're having pain in those positions, that's a great indication that there's room for improvement in terms of the latch and the positioning. And when we address that root cause, we often can drive up production because baby's able to remove milk more effectively and efficiently with a revised, refreshed latch and position. Again, whether we're breastfeeding or pumping or hand expressing, we want to aim to get at least 8 and potentially 12 effective sessions in 24 hours early on. Sometimes babies, when they're cluster feeding, eat even more frequently than that in the first 24 to 48 hours. Hand expression in the first 72 hours, even though it comes in small volumes, really makes a difference. A lot of research has been done regarding hand expression. And when it's both done in addition to pumping and or breastfeeding, and when it's done as a replacement in the first 3 to 5 days of life, hand expression has been correlated with increased output, longer breastfeeding rates, moms meeting their breastfeeding goals, etc. Not to mention it's a handy tool for, if you've lost power, like in an emergency or something like that, and you're able to still extract milk using hand expression instead of having to rely on a pump that, even if it doesn't have to remain plugged up to the wall, it will eventually lose its battery. So great tool to have. Hands-on pumping is similar in that it has also been correlated with an increased output. One study indicated as much as 48% more milk by incorporating hands-on pumping. So what that looks like is you're getting some kind of bra or configuring your shirt, your nursing tank top or something like that, such that it holds the flange against your breast so that you're able to use your hands to massage and do compressions of your breast while you're also pumping. And that does boost output, especially if you're separated or supplementing. Again, bottom line, easy way to remember: if a bottle is given, express or pump each time. Feed the baby and protect supply. Those are the two things that you need to do at every session. So if you want to distill it down to just one thing that you can do today to help supply, try hand expression after a few feeds. Small drops early make a really big difference. A lot of times we have to meet baby where they are. Maybe they're too sleepy to engage. Often jaundice makes for a sleepy baby at the breast, and we have to face that issue, and sometimes that requires supplementation, and sometimes we need to bottle to do that, but that does not mean breastfeeding is over. When you're feeding the baby, you remove milk by expressing or pumping each time a bottle is given, and that way you protect and encourage your supply. So as we transition to our conversation about galactagogues, both prescription and over-the-counter herbal type remedies, we want to make sure that we've exhausted the benefits in increased milk production that we can get from removing milk more frequently. So if you are not currently removing milk 8 times in a 24-hour period, you will see your biggest gains by trying to increase your number of milk removal sessions. Again, pumping or hand expression. Consider meds only after the technique and frequency of your breastfeeds or pumping sessions have been addressed and assessed by a clinician or a lactation consultant to make sure that there isn't another more effective way that we can get to the root cause of low supply and how to boost it. So talking about prescriptions, one that you may have heard about or that other countries use a little differently than we do here in the United States is domperidone. It can provide a modest increase in output, but it is not FDA approved due to an arrhythmia risk. There are mixed assessments about whether those risks persist in the way that we would use them in the world of lactation. However, because of that, it is not recommended or advised or even prescribed very frequently here in the United States for that purpose. It does require specialist oversight, certainly a review of the medications that you're currently on, and informed consent stating that you know the risks associated with consuming it. Another prescription is called metoclopramide, and that has mixed efficacy, but there can be some central nervous system side effects. So if it's used or prescribed, I would be diligent about ensuring that it's a short course with close follow-up with your clinician or provider. Now, more into the space of herbals, which is definitely something I'm more familiar with. They're popular and they have been used for thousands of years. Many people speak anecdotally about the different herbal supplements and ones that they were sure worked and made a difference. Unfortunately, there is no gold standard of research, randomized controlled trials, and the results indicate that these herbals are in fact effective at increasing supply. Now, whether that's because we don't really spend money on that type of thing, or there's no money to be made by the pharmaceutical industry, or it's women's health and nobody wants to spend money on women's health, I don't know the reason, but we don't have that type of research regarding herbals and supply. And as such, you just want to be aware that in the absence of that information, if you do decide to use it, ensure that you are monitoring for sometimes what we see as side effects in terms of allergies or gastrointestinal side effects like gas or discomfort, and know that you want to make an informed choice. The Academy of Breastfeeding Medicine recommends that herbals aren't the path for increasing milk supply. So just if you set your expectations and you understand that you want to address the foundational aspects first, like a good latch in position, milk removal, frequency, technique, etc., then if you want to incorporate herbal galactagogues or prescriptions, just loop in your clinician and make sure that that's a continued dialogue. So bottom line, I get this question all the time. Do galactagogues work? Some see modest benefit, many don't. But I think we fix technique and frequency first, and then we talk about medications or herbals with your clinician. We would be remiss if we did not ensure that we touched on the mental health aspect of perceived insufficient milk supply. Pain from latching, recovering, sleep debt from having to feed baby so frequently and never getting any consecutive stretches of sleep, and anxiety from a combination of all of those things can amplify perceived low supply. So it's really important that we as moms and we as clinicians normalize cluster feeding and evening fussiness. That is a very common behavior for newborns, both of those. And you want to make sure that you're getting support early and often, and that when you have follow-up appointments, you're going to them. Recently, I visited with a mom. She came in for a consult at the 6-week mark, and we were addressing some latch issues. And she disclosed to me that she had been in a place of real depression postpartum. And because of that, she knew that she wanted or would benefit from lactation support, but she didn't have the drive or energy or motivation, and she even said she didn't know what it was that she didn't have, but she didn't have it to call in and schedule an appointment. So I know that can be challenging, and I hope that if that is you and you're hearing this, that just scheduling the appointment and showing up for that follow-up will get you into the environment where someone can see what's going on and hopefully really make a difference and provide some reassurance and encouragement that what you're doing is effective and helpful and good for your baby. To that end, one of the best resources that I can offer is the Postpartum Support International group. And when you go to their website, PSI or Postpartum Support International, they can help you find providers in your area that have been trained in postpartum mental health. And it's a great resource. I've done the trainings myself, and they're very helpful. I think it's really important to sort of normalize postpartum anxiety, depression, mental health issues, whatever we call it, whether it's even just, just baby blues or all of the other myriad of issues you can run into. Very important to normalize that and find a safe space where you have providers who know what they're doing and what to do to help moms going through that. And Postpartum Support International is a really good tool to that end. Remember, pain, sleep debt, and anxiety can amplify the feeling of low supply. Address comfort and rest, and your perception often improves. As we're wrapping up here toward the end, I just want to remind you about the free download we discussed earlier in the episode. Low supply, 90-second intake snapshot. That can help you know right now whether you have concerns that you should be addressing today, or whether you need to follow up soon for additional support, or whether you and baby are on the right track and doing a great job. Themilkproduction.com has a wait list for the Academy and the AI tool, which are both coming soon. And remember, virtual consults are already available. Information about how to go through the lactation network is provided at themilkproduction.com. Thanks for listening to The Milk Production. I'm so glad you're here. We'll be back next week with another conversation to keep you supported and informed. While you wait, you can also find us on Instagram, Facebook, YouTube, and wherever you listen to podcasts at The Milk Production. See you next week.
The Milk Production.